find what? The epicardium, then we get the myocardium, and then there is what's known as the endocardium. But associated with the endocardium is what's a layer known as the subendocardial layer. Okay? And that subendocardial layer, or subendocardial tissue, should we say, maybe not a layer. Let us say just the epicardium, the myocardium, and endocardium. And associated with that endocardium is some subendocardial tissue, some loose connective tissue. And in that subendocardial, in inverted commas, layer, not really a layer, what do we find there? The Purkinje fibers, okay? So that is the layer in which the vessels will run. Now, immediately, when I'm looking at this right here, okay, just for interest's sake, I'm right out on the surface of the heart right here. As I can see some of the major blood vessels. Maybe this could be the inter or the anterior interventricular groove right here. Okay, we don't know. But there we can see some vessels right here. Maybe a branch of one of these coronary arteries. Okay, and a vein traveling with it. But let's not look at that. What we want to look at first is cardiac muscle. Now, what are some of the important features of cardiac muscle? So Kim, who is in the green, Kim, what basically tells us now that it is cardiac muscle? Cardiac muscle.
Intercalated.
What's going to tell us that it is cardiac muscle?
The intercalated circular striation. The intercalated disc.
No, this is an exceptional slide. This is an exceptional slide here. What do we have here? What do we see now? These are the what?
Intercalated.
Intercalated discs. So we're not going to always see what? Intercalated discs. But what really tells us that this is cardiac muscle branching? Okay? So that cardiac muscle undergoes what is referred to as branching. Okay? Branching. No. Because of the stain that they have used in this particular slide, they have won the gold medal in showing us the intercalated discs. But at the same time, we have lost out in what? Not seeing what, Roy? The nuclei. Okay? So we have lost out. This stain, of course, is not what? Picking up the nuclei. Now, Kim in the green, what about the nuclei in cardiac muscle? These are round, centrally placed nuclei. In smooth muscle, the nuclei are long, attenuated nuclei. In skeletal muscle, the nuclei are all lined up peripherally. So you find many of them in a row, just coming off like that in a row on the outer part. In cardiac muscle, the nucleus is centrally placed, and they are intercalated discs. So this slide is a winner in one respect. It's a rare thing to see the intercalated discs. Now, I am a bit skeptical, and you'll have to a bit skeptical of some of the slides that are labeled cardiac muscle. So in your box, there's only one slide that I would put a question mark on, and you show it to any of us. Call us in the lab when you're ready to do it. And the cardiac muscle, I have a strong feeling that maybe about 3 years ago, some of them got away, just like germs, they got away. And these are really smooth muscle slides, but they were labeled cardiac muscle. And sadly, in a couple of the boxes, there's some remnants there of them. Alright? Because in those slides, there is no branching whatsoever. Okay? So cardiac muscle, as we can see right here, and there we can see right in this thing here, we can see what? Branching. Okay? So these are branching. So this, and in fact, who gave me this slide is the very gentleman who is walking in right here. Very good. Alright. You're all in love with him. Very good. He's young and handsome. Very good. So there we see a nice slide of cardiac muscle. I told them that, Larry, this is a very good slide, but what? In showing the in the intercalated discs, they have made this slide now, however, stain is not showing what? The centrally placed nuclei. But the intercalated discs are very well in here. Okay? But as I said, note the branching. And I've also pointed out to them, Larry, that some of the slides that they have, unfortunately, it's the one dubious slide in their box. And sadly, I think that slide is smooth muscle. So they have some slides labeled cardiac, but these were ended up in the box some 3-4 years ago, and they're still lingering on in some of the slide boxes. Okay? And there you can see the connective tissue stained in blue. Alright, so that's the connective tissue stained in blue, and the myofibrils, the contractile elements, we can see in the cardiac muscle quite clearly here. Alright, so the contractile, very, very nice. This is a gold medal slide showing you the beautiful intercalated discs. Mr. Solomon, after giving me, he says no, confess that he doesn't have any more. So what do you think he's going to ask me now? Would I give it back to him? No. So this is a very good slide of cardiac muscle. I remember more. No, here is another slide of heart. Okay, there's another slide of heart right here. Okay. Alright.
Oh, can't do that.
So here the cardiac muscle is quite densely packed together. Alright, but let's see what we see. Alright, okay, up there. Okay, we can see to some degree the branching that's occurring there. Yes, that's not bad, eh? That's not too bad at all. So the branching is apparent here. You can see it. And what's even better are the nuclei. Okay? So there we can see that the nuclei are centrally placed. Alright? Now somewhat I showed them from my lab, and I showed them the difference between the capillary and the. So we looked at capillaries, and we looked at capillaries versus the thin segment of the loop pending. And I pointed out to them that the capillary is going to be the tubule of the smallest diameter, because that's about 8 microns in diameter, whereas the loop pending is about how much microns? About 15. Alright? And we saw exactly where one little RBC was situated in there. So this is quite nice because it's showing us what? The nucleus right in the dead center of the cell, right there. Okay? So the branching. So when you look at cardiac muscle, you have to sort of scan your slide and look for an area where the muscle is sort of teased out a bit, not very densely packed together. And in the exam, we will give you in a region like this where you can see branching. Okay? So this is one of the slides we have produced here of cardiac muscle. It's a bit dense here. Maybe we wouldn't give you in this section. It's too compact. Alright? So you want to find an area where you can see some branching and some centrally placed nuclei. Alright? Okay, this is a bit dense here. We can see also that it is striated. Cardiac muscle is one of the forms of striated muscle. Okay? So it's striated. And if we move it about, we will look and see. Sometimes you can find intercalated discs on these preparations. Sometimes you may see them. But notice, unlike smooth muscle with the long attenuated nuclei, and unlike skeletal muscle with the nuclei all marching along